According to a survey conducted by y'all's university, UCL.
University College London.
I chill. 64% of young Black people in England were vaccine hesitant. And this was 64%.
Majority. Yes, we have good science and we have mRNA technology and all these things, but we have not addressed this huge mistrust that has been building for many years.
One thing about outbreaks is that they don't discriminate. Yeah. Like, you may face racism, you may face all this social discrimination, but viruses like everybody.
People don't see you.
Hello, Globies. Welcome to the World Health Investigation podcast. My name is Jocelyn.
I'm Edna.
And I'm Loza.
We're three young global health professionals and your hosts for the World Health Investigation podcast.
Also known as the WHI, we'll be discussing all things global health and unpacking the most controversial health topics,
as well as promoting new age global health equity and development.
So, ladies, what's the tea in global health?
What's the tea today?
What's the tea today?
It's a little bit hot today, y'all. The tea's a little bit hot. Y'all better be ready.
Okay, tell us, sis.
Y'all know about the vaccine? The COVID one. What do you
mean? The one we're supposed to take in this pandemic.
Is that this panoramic, this Panasonic? God is not ending.
It's about time we address it.
We're talking about vaccine hesitancy. All right, let's get into it, besties.
This is gonna be a real one.
Oh yeah, it's gonna be real, but it's okay. We support anyways. All right, so let's dive in. I'm gonna start with like a little case study, a little one too. Y'all remember in September when y'all know Nicki Minaj?
Nicki Minaj.
Queen
of rap.
Ooh, controversial, but yeah. Well, she posted a little tweet that had people a little shook. Yep. She's talking about her cousin in Trinidad, who does not want to get this COVID vaccine because his friend got it. And she said he became impotent. Is this the cause? They became swollen.
After getting the vaccine?
That's what she said. That's what she said. Allegedly. I don't know. I wasn't there. I don't know him. They got swollen and it's tough. And then he was about to get married. His fiance left him. She said,
laughing. This is a serious matter, y'all.
Yeah. Let's be mature. She said, she didn't want parts with it. So in the end, she told everybody, just pray on it and make sure you're comfortable with your decision to get the vaccine and not to get bullied into it. All right. Fair enough. Twitter erupted that day. People were screaming and throwing up, and opinions were split, as they always are. People, on one side were in support of her. They said, finally, someone's speaking out. Like, I don't feel comfortable taking this vaccine. I don't know where it came from. I'm hearing these stories as well. And then on the other side, healthcare professionals and other people were like, oh no. Someone with, a lot of influence is sort of spreading information to discourage people from taking the vaccine. So, the government was a little involved. They're like, Nikki, it's okay. Like, we'll educate you about the vaccine. Please don't say that. And so I found it interesting because it was like a little example of like what I see within like my own circle, like people I know in different communities, of how people have reacted to this COVID vaccine, and particularly amongst our peoples, of Black people. And so like I looked into it. I wanted to see what was going on. And so different countries obviously have different statistics, but in the UK, according to a survey conducted by y'all's university, UCL.
University College London.
I chill. 64% of young Black people in England were vaccine hesitant. And this was 64%.
Majority.
It's higher than I was expecting, y'all. Okay. Low key. And this was vaccines in general, not even necessarily the COVID vaccine. So you can imagine now with a Panasonic, the mistrust is a little higher. You know what I mean?
Yeah.
And just to define what vaccine hesitancy is according to the WHO, they define it as it's a delay in the acceptance or just complete refusal of, well, they say safe vaccines despite the availability of the vaccine. So that's what vaccine hesitancy is.
Yep.
So
I think we need to put a little disclaimer before.
I think we do.
Disclaimer for this one.
It's because it's what is it? I feel like it's a tricky topic, especially now, and we don't want to be speaking down on people.
Yeah.
In a pandemic that is always evolving, and we're always learning new things.
Absolutely, that's one thing to consider. Science is always changing, so y'all gotta stay on top of it.
Yeah, and this podcast is not intending to discourage anyone from taking their vaccine or invalidate their fears. So
exactly,
we're doing this based on well-rounded research and not only our opinions.
Yeah, do it that way you will, definitely. Like, it's not to tell you your fears are invalid, you're being dumb. No.
Exactly.
We're not trying to do that. So now, how do you guys feel? Y'all got the vaccine?
I got the vaccine. I got my 3 doses.
Or you got your 3rd dose?
A little mix and match. First 2 doses were Moderna. The 3rd one was Pfizer.
Indeed. Yeah, they say it offers better protection.
Yeah.
Yeah, I had my first 2 doses were actually Pfizer.
Ooh.
But what's funny is that I had my first dose, and then I had COVID.
Rona got you.
Then the Rona got me. It caught me, finally.
Finally. You were ready for a fight, weren't you?
I wasn't ready because I was expecting to get my 2nd dose, and then I had COVID. So, and then I had to wait for like 4 weeks after I recovered from COVID to get the vaccine.
Okay.
But, yeah. I mean, to be completely honest, I was a little bit hesitant when it first came out because I thought it's a bit too soon. I'm out. I don't know what's going to happen. Then eventually, I did further research and I kept getting these GP messages.
They say, please come.
You better come.
Yeah, I think for a lot of people, it is that the vaccine came too soon was a big concern. But I'll say this, in the world of science, money goes a long way, and there was a lot of investment into it because COVID was stopping people's economies, and people didn't like that. They said, hurry up and fix it.
Hurry up. For once, they all came together so quickly. Think about how HIV has been with us.
Yeah. And have you read, like, now, because of the COVID vaccine, they're like now thinking about making a vaccine for HIV. Like, it's inspiring people.
Like, we had HIV for decades and there's been no vaccine.
Yeah, because it wasn't.
And now COVID is affecting our economy. So everybody got together. All the major scientific biopharm, everybody got together.
Yeah, I also heard they were scrambling. They're making money. Like,
let's also not forget this was the same case with Ebola.
Where
the vaccine was developed fast.
The moment they reached the United States of America.
The US, in the UK.
Yep.
So there's also that aspect to it. It's not just some disease far away over there in some tropical whatever,
We know how they feel about the tropicals, but exactly, that's why they were quick. When it comes to their money, they're quick. But now, I want to focus on my people. And so I wanted to look more into, like, why is there a higher hesitancy amongst Black people? Like, there is hesitancy, like, in all demographies, but why is it higher amongst Black people? And I mean, we spoke a lot about this in our Decolonizing Health episode. Go watch that. But within the medical system, it doesn't have a very good track record with Black people, essentially. There have been, like, instances that have created, like, mistrust within the community that are, valid. For example, the very famous ones, there's the Tuskegee experiments, which we touched up on, the case of Sims Lags. I don't know, Edina, if you want to explain that one a little bit.
Yeah, so the Tuskegee Syphilis Study, I think, is one that people continue to bring up, especially people in America. So for people that don't know a little bit of history about the famous Tuskegee Syphilis Study, essentially, what happened, it was in 1932, in Tuskegee in the US. 600 African American men were recruited for a study on the progression of untreated syphilis. So back then in 1932, there still wasn't treatments for syphilis when, the study first began. But in 1947, penicillin became like the standard treatment for syphilis. Like by 1947, they had it now. But the thing is, the treatment was still withheld from participants in the Tuskegee syphilis study. Now, that obviously is very unethical. Like, that could never happen today.
No.
But what it brought up, I would say, for me, just sort of like analyzing and giving a bit of my personal perspective, is that probably I would suspect that the treatment was withheld because, again, they were using Black people as the participants. And we know America and many places in the world have a history of not really valuing Black people's lives.
Yeah.
So they could afford essentially to be like, yes, we could give them treatment.
We kind of want to see how this disease progresses even after finding treatment.
Even after finding treatment.
Edna, please, I'm sorry, correct me if I'm wrong. I also read somewhere that some of these patients, people got infected with syphilis and then they were withheld, they didn't get the treatment. And on top of that, some of them already had syphilis. I'm not sure if that's correct, but I think that's mad.
It's really mad. I think they were I think it was people that were already had syphilis.
People that already had syphilis. In fact, I think back then they used to call it like bad blood or something. And so when they were all recruited, they were told they were actually going to get treatment for bad blood. So obviously, if I'm there, I have syphilis already, and they're like, come part of this study, we want to treat you. Yes, of course I will sign up. But already that was a bit misleading because they didn't have treatment at the time. And even when they found it, they didn't
withheld it.
So.
That's, exactly. So that was just one example. I think that's the most like famous example of like cases where Black bodies have been dispensable in medicine. And so for some people, that is a reason why they still have mistrust of like the healthcare system. But it's not always like, people always, that's a backdrop of it, but it's not like everyone sits there and they're like, suspicious of this vaccine because of like historical reasons. People also have like currently bad experiences within the healthcare system. A lot of Black people have their pain denied in healthcare systems. They are not taken seriously. So then it is very difficult for them now to, in the face of this pandemic, that is scary to run back to the same system that sort of denies their own experience and denies their own pain. And that is a reason that is cited often for why people kind of don't want to participate.
And I will say, go on, Jocelyn.
I was going to say that what really baffles me the most is that when we see the Western media reporting that Black people don't want to take the COVID vaccine, Africans don't like the COVID vaccine, or they fail to report their personal experience, they fail to report the historical context, they fail to report the people's experiences and try to understand the reasons why they're deciding not to take this vaccine. It's 100%. Not for any random reason. If 100%. That mistrust is there, that needs to be addressed.
Yeah, and this goes back to the passive language of like, the COVID pandemic is affecting this group more, and this group doesn't want to get the vaccine. And like, it's very, very passive when they kind of make it look like race is the issue when racism is the issue.
Yes, 100%. And again,
going back to this one.
Going back to this one. Yeah. Race is not the risk factor, it is the racism that is the risk factor. Yeah. But I think also something that we touched upon in the decolonizing episode is the reason why we think about the historical context is the fact that, like Loza said, we still see it affecting us in the present. And I think for me, the story that was very funny at the beginning, if you guys remember, that French man.
That French put that out.
That really went on TV before the vaccine.
The doctor.
Was it when vaccine trials were just starting or about to?
Just starting. Were there even vaccine talks back then? This was 2020.
It was
the corona had just started.
Yeah, it was at the prime beginning of COVID.
Beginning of COVID, they were already like, Africa is going to be hit the hardest. And therefore,
they were foaming at the mouth for that case study.
Yeah, we should go and test this vaccine. We should go have clinical trials in Africa.
Yeah, he said they're gonna die from it anyway. So let's just recruit a couple.
Let's do there.
He said people got mad. He said, "Why are y'all yelling at me? I'm just trying to help them."
Yeah. And that's what I found. Again, it was giving like, oh, we can just go test it on these Africans, these poorer black people, and because similar to Tuskegee, it's giving your lives don't really matter that much.
And it's a little bit of like a theme I noticed in global health, a little bit,
Exactly, and that's why it's important for us to still recognize the history, like you said.
100%. Like I think it's important when people talk about vaccine hesitancy. I think people really discount people's experiences. I see it a lot from the perspective of healthcare professionals being like, okay, it's just because they're uneducated and they're just going on Facebook and getting it from Facebook University. But maybe sometimes Facebook University treated them better, relieved their pain.
Yeah.
And so like, look, I think science communicators and healthcare practitioners have a responsibility to gain the trust of people and not really look down on them and talk down on them when after years of trauma, they don't want to participate in kind of their
I'm sorry, like no matter how much research you have done, how many papers you have published, how many conferences you have attended to speak about this vaccine, if you don't address the root of the problem, you don't address that mistrust, there will continue to be vaccine hesitancy, and there will continue to be these new variants, and they will continue to need people to take the vaccine, and they will continue to say no.
Yeah, we will need more boosters.
We will need more and more boosters. I feel like this vaccine hesitancy concern is even almost as important as finding these new boosters.
100%. 100%. Because what I find interesting is that, yes, we have been able to quickly develop these vaccines, which is almost like a feat in and of itself.
It's amazing. Like, people don't appreciate how amazing, like how quickly people, science has moved. But
exactly, like, I know people were concerned about how quickly that is, and we can dive into that. But I think it's a feat in of itself that we're, when we pull our resources together, we're able to do this very
things
fast.
are possible.
But all of that does not matter if people are still not going to uptake the vaccine once you actually release it. And a key reason for that is there is maybe decades, hundreds of years of history there that we still have not addressed. Yes, we have good science and we have mRNA technology and all these things, but we have not addressed this huge mistrust that has been building for many, many, many decades.
There's a disconnect. And I mean, even when COVID started, you could see the conspiracy. So like, I knew it was coming. Like, I knew the hesitancy was coming. And I don't know how that wasn't addressed initially. I think a lot of like the talks I saw about the vaccine was like, yeah, it's coming in 6 months. Everyone's going to take it. We're going to get out of this pandemic. And I said, are y'all sure everyone's going to take it? Have y'all considered that one? Have you seen what people are saying? There's a disconnect, I feel. And then they act surprised. They're like, oh my God, why y'all not taking this vaccine?
What's crazy is that when this vaccine came out, as I told you, I mentioned before that I was a little hesitant.
Right.
I was not necessarily hesitant because I was doubting the science. I was particularly hesitant because when I was about to get my first vaccine, some of my family members were yelling at me. I had family members come to me after I got my first dose. I was told, oh, you don't know what's going to happen to you. You're going to become sterile. These white people don't like us. They're risking your life. If at the age of 25 you don't have children, don't be surprised. You're going to get all these brain diseases. It was told to me. And it really made me think these are the things that I've studied during my course. Right. I've literally studied all these vaccine hesitancy stuff, and it's happening live.
Right.
It's my own people, my own family, my own friends.
Yeah. No, yeah, it's true. And it's like, of course, you hear all of that. How are you not going to be scared? Like, oh, maybe I don't want to inject this into me. Mm-hmm. And I think it needs to be communicated better. But I think what I want to say to these white people don't like us. If this vaccine, I mean, but if this vaccine was so bad, and if it was to target us, they would not be running in droves to take this vaccine and keeping it from African countries. You get what I mean?
Yep.
Like, they would not be hoarding it. Like, they'd be sending it for free.
They'll be sending it for free.
Why do you think these countries are fighting over it? Like, this one, this one is actually like, if my measure is if they want to take it this bad, it's probably good. Like, yo,
probably good.
They'll take advantage because they probably don't want to get you to begin with. But
yeah, I'm not gonna lie. Generally in life, I do sort of pay attention to what the richer, maybe
the rich people do.
wider people are doing. Because usually those are the first groups of people that will be protected by something.
Yes.
If they're also taking the vaccine, they also really want, all of us to be out of this pandemic because, it's affecting them too. So
it's affecting their money.
That's why I was feeling already a bit like, this should be fine.
Yeah, part of it, and also
also the science. I was like,
science.
Yeah,
also,
like
the science,
communities,
of course.
Yeah, and not only just the COVID vaccine, but I think with the percentage of vaccine hesitancy for all other vaccines, I think it's important to understand vaccines are a really big scientific achievement at the end of the day. They've reduced mortality significantly. I think a lot of people say, my great grandparents didn't need vaccines, they were fine. Natural immunity kicks in. But people don't consider life expectancy. The reason why it's increased so much is because especially child mortality has decreased significantly as a result of vaccines. Y'all don't hear about people with polio anymore. Y'all don't hear about people dying from measles anymore. That's because of a vaccine. It's not some crazy thing that's here to control you. It really is just a little thing to help your immune system fight diseases so y'all don't die. That's it.
I've heard different people say things like, okay, it's not necessary. I don't have to take it. Why should I take something if I'm already infected anyways? Why should I take something where policies and guidelines keep on changing? The first said we'll take 1 dose, then it's 2 doses, then it's 3 doses. There might even be a 4th and a 5th dose. We're going to keep on taking doses. Does the government and do these companies know what they're inserting inside of our bodies?
Right.
But let's address that point. I think we need to unpack that and address that specifically.
Yeah.
And I think it's valid, especially because I think initially when the vaccine came out, it was it's gonna prevent infections, and then whoop, we did a left turn, and now you'll get the vaccine, you'll still get infected. You said you got your first dose, you got infected. I had my 3 doses. I had COVID last week. I was filming a podcast with COVID. I was okay. I say because of the boosters, but I think it's important to address how it was communicated. I get why people are unsure and mistrusting of it because the information keeps changing. But what I will say is it's because science is always changing. You don't have to accept everything you're told as a solid thing and it will never change. And it's the reason why now you'll get infected is because there has been so many variants. We're on Omicron, we're on COVID 5.0, you know what I mean? The original COVID from 2020, she's gone, she's dead. We have had 20 variants. And consider that this vaccine that we're getting was for the original one. Science is moving fast, but COVID is moving faster. But
it is moving faster than science.
It is.
If you understood the way this virus replicates and changes,
it's crazy.
At the speed at which it changes, I'm even shocked that we got this vaccine so quickly.
Yeah. And so because it's moving so much, then the statistics are also changing. It's not because they don't know what they're doing. It's because there is as the virus changes, you also have to adapt the recommendations at the end of the day.
Yeah.
And so I think people have to consider that it's not always, science is not one thing is true and it's true forever. It's going to be changing.
Yeah. I think more broadly for me as well, and Loz, I think we've spoken about this before, is an issue in terms of how science is communicated. And it's it's not a surprise that we see some of these things because we know science is a bit hard to communicate. And I think part of it as well comes from governments as well fail to give people the expectations. Let's say the 3 of us, we have studied biomedicine, medical sciences. So we know a little bit about virology. We may already be oh my goodness, we know about how viruses replicate, RNA viruses. So we, it's
see it coming.
We can see it coming where there could be variants and it happens, right? So we would not be too shocked if that were to happen. We're we kind of wouldn't see this normally. But the government never communicated that. No. The government works with scientists that know this the same way.
And the scientists tell them.
The scientists tell them, but the government still does not communicate to the public. The government was like, lockdown, let's flatten the curve. Only 2 weeks lockdown, guys. Only 2 weeks.
Yeah,
all we need.
Yeah.
No, now we saw that as the public, it wasn't just 2 weeks. So already we're not trusting, the government is not able to give people realistic expectations of how a pandemic can actually evolve.
Yeah, 100%. I think that's a big thing. Governments don't communicate these things because it doesn't really help them. Like, people will panic, I guess, if they, or at least I think they should give people the benefit of the doubt. But yeah, they started with like, we're going to flatten the curve and it's going to be 2 weeks, because people would panic if they hear 3 months, 1 year, 2 years. But you need to really communicate a realistic thing, because then to people, it's going to look like left turns or right turns when the government keeps extending things and saying, oh, now there's a new variant and now there's a new booster. And people are like, what's going on? This was not part of the initial agreement.
And one thing we've seen even in previous pandemics, one thing that's very common is that if something is miscommunicated, if people don't understand things very well, there will be public fear.
Yes, they will make their own.
People will fear something that they don't understand. And if you're someone that, okay, we're not here to say that, okay, your fears are not valid or not justified. We understand those fears. We have faced those fears ourselves. But think about it this way. The vaccine offers you some protection. It offers you some protection from being hospitalized, right? It's kind of like you're going to war. Imagine you're going to war. You don't have a helmet. You don't have anything. You just
no armor.
You decide not to take that vaccine. It's basically like you going to war without any protection, any protection from being severely ill from these new variants. And the reality is, I'm not saying that I want it to happen. I wish I didn't have to say this. But there will be new variants, and we're gonna have to adapt, and we have to do it together with nobody left behind. Because if one group is left behind, even if it means us, then everyone goes down.
And I think I like the analogy you used of war. And another one that I think could help is one like my dad was actually saying. It's like with car accidents and seatbelts. Just because accidents continue to happen, does that mean we're not going to start saying seatbelts are not helpful? Seatbelts can still help you reduce the likelihood of like dying in a car crash, right? It makes sure you're not going to jump through the windscreen and hit your head on something and die. Similar thing here with vaccines. Simply because we continue to see variants and we need these boosters does not suddenly mean that the vaccine is not helping at all.
No, the vaccine is still very helpful. Believe me, if we didn't have this vaccine, people would be dead.
Yeah, I mean, like, I want you guys to do, if you want to do your own research, it's true. Like, if you look at the COVID graphs, like, look at them in the UK. I'm from Switzerland. I look at them in Switzerland. Look at it in your country. Look at the vaccine coverage, and look at the infection levels last year and the hospitalizations and the deaths from last year, and compare it to this year. Like, you can actually see the vaccine working, because infections are a lot higher this year than they were last year, because most countries were not in lockdown anymore. I know Boris in your country, he said no masks as well. So like, infections are crazy. But the good thing is people aren't dying as much anymore, and people aren't in hospitals as much anymore. And we can't deny that like the vaccines actually worked and helped with that. And that's the main goal of it. Like, I think people I think they're doubtful of it because it doesn't prevent infection, but that is not the claim. It's not the claim. It's just, it will help you not get severe disease.
Yeah, and it's important that we really clarify that. We're not saying that if you get the vaccine, you will never get COVID, because yes,
I got COVID.
But believe me, and also even as an epidemiologist, there is not going to be an end in a pandemic without immunization. Immunization means for us to end, this is just plain simple. I've said it before, I'll say it again. We cannot end a pandemic that affects the entire world without some form of immunization. So the vaccines, they may not be as effective. Yes, we agree with you on that one.
They're working on it.
We're working on that. They're working on it. What you can do on your side is make sure you make well-informed decisions, and that you understand that science is not everyone is out here trying to get you and kill you. Now we have their very rigorous procedures, control trials, the critical, very, very critical.
Extremely strict, because, you know, like, remember, these companies are getting sued, are scared of getting sued. Like, they also have to make a lot of safety checks, because if you get a bad name in the industry, you're finished.
You're finished. And that's why I understand that, yes, in the past, it hasn't been the case, but times have changed. We still do we still do experience medical racism. I understand that because I've experienced it myself.
Right.
But in terms of science and something that is affecting the whole entire world, think about it. Just
you get what I mean? Yeah. No, I agree with you.
So I wonder, guys, what do you think we could be doing better in terms of like actually addressing the vaccine hesitancy we're seeing? Because 64% is still a shocking statistic to me.
It's big, isn't it? Yeah.
I don't know, Joseph, do you want to go first or should I go first?
Let me think a little. I mean, it's a hard one. It's a hard one because obviously if there was like an easy fix, it would have been done, right? Yeah. They would have been like, poof, okay. But public engagement is so important. I think as we've seen, like we've addressed, there is a lot of mistrust of vaccines because of mistrust of healthcare practitioners. So sometimes, you know, providing this reliable information from like a place people trust. Yeah. Right. Really like engaging with the community and not coming to them and being like, okay, I'm going to tell you all of this stuff. You have to believe it. You have to accept it. But like, you know, answering that people have a lot of questions that go unanswered. Answering their concerns, answering their questions, not completely discounting them and saying it's because you don't, I don't know, research properly. Yeah. Not everyone has scientific literacy. It's okay. Like, it's not everybody that's going to study science.
And it's not their expertise.
It's not, and it's the responsibility of people, or like, you know, it's the responsibility of the government and pharmaceutical companies to communicate their results without all the medical jargon, because and nobody trying to read a research paper about the clinical trials that Pfizer did. You get what I mean? Yeah. I think that's one big thing. And another thing, when it comes to ridiculing, I mean, with at least, okay, so me, I only know Switzerland. But when I say public engagement, so there was a lot of hesitancy in Switzerland. And the government's approach to me was a little questionable. One of their public engagements was releasing a bunch of ads that showed people doing like really stupid things, like eating Tide Pods or whatever, and saying like, oh, Mark will eat a Tide Pod, but he won't get the vaccine. He's dumb. And like, to me, it's kind of like stroking your ego of like, me, I know the science and I'll get the vaccine. I'm like, these stupid people. Yeah. It's going to alienate people even more. It's not really.
Yes. And just to echo what you said, to echo what you said, Loza, I think that is the problem. Right. The moment we start segregating and bashing people that are vaccine hesitant, that's when they will have more and more reasons to come to be against this vaccine.
Absolutely.
And if you're trying to tackle vaccine hesitancy with emotion, it's never going to work.
Right.
Give them the science, give them the information, give them answer the questions.
Answer the questions. That's my big thing.
You making them feel bad and stupid, it's not going to help.
Right, because I often hear people being like, believe in the science. You don't believe in science. Like, you're meant to question science to begin with. Let people question it. Yeah. You know?
And I feel like in the UK as well, I don't know if you guys remember during the pandemic or at least the summer where lockdown was first eased, and then they were suddenly being like, oh, these young people, they're the ones going out there and causing...
After giving us the eat out to help out thing.
After
I never forget that.
And then they come, like, it was again this whole public health messaging of like blaming certain people for things and shaming people, like, you are the one that's causing this. Like, I don't think that's very effective. I don't think that's
not effective.
And
I think as we're not medical professionals, but as healthcare professionals or healthcare scientists, or in fact the whole global health community, if you're trying to address vaccine hesitancy, before you even speak, ask open-ended questions.
Right.
Let them ask you questions and address, because everybody has different concerns. Yes. I've had people say that I don't think it's necessary. I've had people say that, oh, the vaccine, why should I get a vaccine if I'm still gonna get infected? I have people say that, oh, I'm scared of the side effects. But people say there's so many.
Yeah, it's not just one reason. People need to understand that too. Yeah.
Yeah. 100%. You need to really actually understand what people's concerns are. You can't just assume that it's because they don't know how vaccines work. You can't just assume it's because they don't understand science and you just need to educate them. No, it's not that. You actually, we don't know. We can't tell you what everyone's concern is. You need to go find out.
Yeah, it's as unique as how many people there are in the world.
Exactly.
And once we understand that science is very difficult to communicate, science is it's very complex. These viruses, I'm sorry, it's very complex.
They're smart, the viruses.
Yeah. Immunology is a very, very complex subject.
Yeah.
But then at the same time, we have that duty to communicate at every single step of the way. Because I've seen, like, even in a lot of African countries that have dealt with epidemics, I'm sorry, I've seen some very good communication there. When I went to Cameroon during the cholera epidemic, I was seeing flyers everywhere about how it works, what current vaccines are available, what treatments are available, literally very, very big flyers. And we could do something very similar. If right now you could have a poster, a flyer around public transport, whatever. Yes, they have some hand sanitizer, what do you call it, symbols. But I'm talking about how specifics about how the vaccine works, basic information that people need to know. And that would help them reduce that fear that they have.
It's true. Yeah.
I think the other thing to point out is it's not necessarily also like, the concerns you address and the message you're going to deliver. You also need to consider who is delivering the message.
Right.
Right. Because we see this thing of people will have different levels of trust for different people in their community. I think, Loza, you're talking about how some people have been told by their church leaders or something that don't go get the vaccine.
Don't get the vaccine, yeah.
And they're more likely to listen to those church leaders.
Yeah, exactly.
Than they are to the government.
Absolutely, because like at least with the consistent, the communication is consistent. So they're like, yeah, okay, we'll listen to this person. Engaging with people that the community trusts is important. Like a random stranger with a lab coat, it's just not, people are not receptive to them all the time. I'm not gonna lie. But yeah, and I think it's just important at the end of the day, like my takeaways, I think we just need to stop preaching to the choir. Sometimes we just say the same things that we all agree with. Like people that want to take the vaccine, we just say the same thing over and over again to each other. And we say, yeah, like we know the science, we understand, and then don't really tackle the root problem. So it just continues. So ask questions, answer questions.
Yeah. My other recommendation, I think, Jocelyn, you touched upon this in terms of like involving people at every step of the process. Because I think the concern that I guess surprised me a little, well, it's not really surprising, is this whole thing of like, the vaccine trials, the vaccine was developed so quickly. People were like quite shocked by how quickly it was quick, developed. And maybe for me as well, again, like saying based on my studies, where I wasn't as surprised because it's like, I knew, for example, that the European Medical Agency, they have emergency authorizations that they can do. Like they already have processes in place
for pandemics,
to quickly develop something and then quickly get it to market. Even FDA in America, they have these processes. So I was like, yeah, that's fine to me. But not everyone knows that.
Yeah.
And not everyone was involved, or rather community was not always involved during the clinical trials themselves. Like, people didn't even get the chance then to ask any kind of questions that scientists, the people running the clinical trials, could have addressed at that stage already.
It's true. It's such a good idea to really inform people, okay, this is where we are at, and like communicate with people, and this is how it's progressing. This is the data at the moment, 100%. Because if you Google how long a vaccine takes to develop right now, you'll get like 10 years, 15 years. So then people are like, wait a minute, this one came out in a year.
Exactly.
What am I thinking? But it's
and I've seen it, and I've seen that in science. We tend to just put communication as that one thing that you just gave or just brush off. It's almost as important as finding these vaccines. Because there's no point of you creating a vaccine if people are not going to take it.
That's where it comes down to at the end.
Legit.
But yeah, what do you have to say to the people, you guys?
Oh, my people.
I have to say to our people.
I would say that, again, we're not here to bash anybody. We're here we're speaking from a place of love, we're speaking from a place of research. And that before you, I have a message for the people and one for the scientists.
Right.
Now, for the people, I'm saying that science is not all bad and that they're not out here trying to kill you or trying to torment you. We understand that medical racism exists, and we understand that we have been oppressed for so many years. But at the same time, we need vaccines to end.
Take advantage of it. Yeah.
Advantage of it. And also having that peace of mind. Don't you want to be able to go out knowing that, okay, I have some protection.
Right.
I'm protected from this, you know?
It's not like, honestly, let me be honest. When I got COVID, I was sick for maybe 3 days, sore throat. I was done. I had some friends that were coughing and dying.
Yeah.
And I mean, I have a bigger peace of mind just being like, okay, I have some protection, you know?
Yeah, I don't have that fear that, I'm going to die from this COVID. If I get COVID,
I'm going to be hospitalized. I'm going to,
Yeah. No, completely agree with you there, Jocelyn. I think the main concern for me is with the public engagement. It's like it's not always on the public sometimes to like actually, like just be able to accept things. Like it's completely understandable to me that, no matter what you just put out there into the world, it's not everyone that's going to be ready to just take it up and run with it. And you need to be able to address like those concerns from the public right from the beginning. Like make sure you understand your public. If you are in government, if you are in science, if you are in clinical trials, understand the public, the people that are at the end of the day gonna take up that vaccine.
Yeah. And I've sorry, one more thing, last thing. I've also heard people back home, as in like in Cameroon, that have said things like, it's not a Black person problem, it's a white people problem. We don't have it in Cameroon, so we're not gonna die from it.
Yeah.
One thing about outbreaks is that they don't discriminate.
Yeah.
Like you may face racism, you may face all this social discrimination, but viruses like everybody.
People don't see you.
They don't care.
People don't see, she don't got eyes. She doesn't see color.
The Rona don't care.
COVID doesn't see color. COVID affects everybody. Yeah. And if anybody is left behind, outbreaks have no barriers.
Yeah.
It could break into right now. It could break into Zim right now. It could break into any African, Asian, Russian, anywhere in the world. It could come for you. So be prepared. Stay prepared.
They don't respect your borders. They don't respect your race. Vaccines don't. I mean, what's this? The virus does not care.
The virus
does not care. She doesn't see color. Thank you. No, thank you for that.
She doesn't see color, unfortunately.
On that note.
Let's conclude. So thank you very much for listening to the World Health Investigation podcast. I'm Jocelyn.
I'm Edna.
And I'm Loza.
And we are 3 young global health professionals and your hosts of the World Health Investigation podcast. Thank you and see you next week.
See you next week.
Bye, y'all.